What's up, Psychedelic Investors? My name's James, and you're watching The Psychedelic Investor, your number one news source for all things psychedelic business. Today, we got a really big treat for you. We're going to be discussing how it is exactly a person can access psychedelic therapy up here in the great white north of Canada, my home and native land. And to do so, we're going to be talking with the founder and co-CEO of ATMA, Mr. David Harder. So without further ado, let's bring on the man of the hour himself. David, how are you doing today?
Doing great. Thank you for having me.
Well, thank you for being on the channel. So I guess right off the bat, let's hop right into it. Can you tell us a little bit about the company that you co-founded, ATMA? What is the purpose of the company? What differentiates it from other psychedelic companies? And really, what is the mission or problems it's trying to solve?
Yeah, we started ATMA with, as so many companies that started in this space, with a passion, understanding that these medicines work for so many people, and that we're seeing that there's a lot of jams opening up in Canada for legalization, deregulation, or who knows what, decriminalization, we're not sure. And so about a year and a half ago, we started this company with that intention in mind of bringing these medicines to the people. Not fully sure, and as most companies have had to pivot here and there as things changed, which route we'd be following, but very quickly realized Section 56s were the first thing that opened up that allowed us to do these medicines. And since then, very much getting ATMA focused on educating therapists so that when these things do open up, that there's people that really understand how the medicines work and people that are qualified to help people through the process of both pre and post psychedelic process integration.
So just to summarize that, to make sure that I understand what you're saying, ATMA kind of has two main focuses. One would be the training of the therapists to ensure that they understand how to conduct a psychedelic therapy. And then also you have the running of therapy itself and treating patients who need, say, psilocybin therapy. Is that kind of the base duality of ATMA?
Yeah, I would say that it's really focused more and more on the tip of the arrow, which is the therapists. But with that, we've also, for a year now, been doing treatments in our clinic in Calgary with the Section 56 exemption tool.
So we're going to get to Section 56 in just a moment, because I think that is extremely fascinating, and especially for a Canadian audience that might not necessarily understand that there is this kind of little legal avenue for people to get therapy using psychedelics. But like I said, we'll get to that in a moment. Let's get back to the tip of the arrow analogy that you mentioned, because one of the things that we've talked about on this channel a lot before is one of the really big bottlenecks of the psychedelic medicines industry in general is going to be getting the thousands and thousands and thousands of therapists needed trained up to a level that's sufficient to kind of put a dent in our mental health care crisis. Like, we've got depression all-time high, anxiety levels all-time high. So I was just wondering if you could talk a little bit about how ATMA is training therapists to try to put a dent in the mental health care crisis.
Yeah. Over a year ago, March 1st, actually, we started our first therapist training program. It's an introduction to psychedelics, and really an overview of the psychedelics for therapists. And what does that mean? What does it mean to bring that into your practice when this becomes legal? So we've been doing that every month for the past 12 months. And over 300 therapists now have come through that program. But knowing all along that that's the first step in training therapists, it's getting them the information. How does this work? What are the medicines? What are they used for? What does integration mean? What is intake? What is ethics in the psychedelic process? So that we've been doing now for over a year. Go ahead.
I was just going to ask you what those three things are then, if you could expand on each of those: the integration, the intake, the ethics of psychedelics.
Yeah, as we're seeing in so many news stories coming out about ethical violations within the psychedelic process, what does it mean to have healthy touch versus touch that is not okay? What does it mean to hold space? So it's such an unlearned skill in most therapy processes where it's talk therapy and you're very engaged in the process. And so even crossing boundaries of waking somebody out of their process when really you're there to hold the space for that client going through this journey that's very private. And then afterwards, the integration piece comes in. What do you do with those things that you saw in the process of the journey? How do you bring that into your life and make it so that your life is better? Not just, I had a high, I had this really cool experience. But what do we do with those things that we see, even the mystical experience? How do we bring that back and make changes in our life that are going to actually improve our mental health, PTSD, addictions? So these psychedelic experiences are part of an overall protocol. It's not like the psychedelic is going to fix people in and of itself. It's part of a process. So the intake, is this a suitable client for this? Is there criteria upon which this person may not be the best client for this psilocybin or MDMA or ketamine? So those matching those up with the right medicine and the right protocols and the right therapist for that matter. And then the actual journey, holding the space with ethics, having very clear understanding of what touch is, of what the process is, what dosage is, and having the client know what they are getting involved in, not just throwing 5 grams of mushrooms at them and say, here, have fun, but really understanding what is that process. And so all those things come into ethical guidance of a properly held psychedelic journey. And then the integration piece, which, like I talked about, is bringing that back into the person's life in a way that is really going to be beneficial.
That's amazing. So if I'm in Canada right now and I'm interested in maybe trying to undergo a psychedelic therapy to treat maybe depression that comes with a terminal illness or just regular depression, what avenues are available for a Canadian to undergo psychedelic therapies?
Very little, actually, when it comes down to it. Unfortunately, we're not there yet. Section 56 opened up almost 2 years ago with Therasil's first applications. For Thomas Hartle was the first one to go through this. And
Could I just get you to back up a second and maybe explain what you mean when you say Section 56?
Yeah, in Canada, there's exemptions for accessing scheduled drugs. So they have a section, it happens to be a Section 56 exemption, where you can apply as an individual, not as a doctor, not as a therapist, but as an individual, that you want to access a drug that is not currently available through prescription. So you can make that, and it's a long process. You have to prove the safety and all these things about that drug in your application form. So we've been doing, and there are still a number of other people have been doing these applications on behalf of clients, but it's client-driven application to access, in this case, psilocybin for end of life. And primarily what they've been granting is palliative care, end of life, Section 56 exemptions with psilocybin for treating end of life anxiety and distress. Those have been slowly closing. Health Canada made an amendment to the SAP, the Special Access Program. I don't know if you want me to jump into that right away too, because they're all kind of interrelated. The SAP program on January 5th, Health Canada said, we have a new way to access psilocybin, and we want you to go through this process now, which is the SAP Special Access Program. And that is a doctor-driven program. So doctors apply on behalf of their client or patient, and then they're able to provide psilocybin to their patients if they meet this long list of criteria that Health Canada has set out to access these drugs.
And how frequently are people getting approved under this, either Section 56 or now the SAP, the Special Access Program here in Canada? Are we talking 1 or 2 people? Are we talking several hundred people, thousands of people? Just how frequent are exceptions under these rules?
So the Section 56 exemption, I believe there's been around 70 or 80. We've had 20 come through our office here. So very small numbers. It's an individual process. It takes weeks to get an approval. We've had a couple that came through within like a week because it was very near terminally ill patients. And then there's been a few therapists. A year ago, there was about 18, I believe, somewhere around 20 therapists that were approved for a Section 56. But Health Canada since then has been very clear that's not what they want to be approving these for. So it's about 70, 75 people that have actually been approved for this therapy with psilocybin. With SAP, there's, from my understanding, it's at most a handful that have actually been applied for. And to my knowledge, to this date, I don't believe any have been approved. I may be wrong. I know there's one in BC that has been applied and that may be approved by now, but I'm not sure. But right now, it's very difficult to get an SAP approval because there are a lot of criteria and a lot of risk on behalf of the doctors. The doctor basically takes on full risk for the patient and does all the work on behalf of the patient and is required to be the person with the patient when they take the medicine. So it's very time intensive. And I don't believe we're going to see a lot of numbers coming through the SAP program any more than the Section 56. It's going to be one at a time, very individual.
So in other words, what the Government of Canada, Health Canada is mostly pushing people towards is these clinical trials that are currently being underdone for psilocybin, MDMA across the country, North America, etc.
Yeah, in fact, even SAPs, if there is a competing clinical trial, they will say no to the SAP application because it's getting in the way of that clinical trial. And they say there is an opportunity for you to take this therapy in a clinical trial setting where there's much more rigorous oversight and safety.
And do you agree with the direction that Canada is currently going in, or do you think that we should maybe open up the SAP process a little bit more, or do you think we should just take a step back, wait for the clinical trials to get worked out, and then we can open the process up?
That's a loaded question. I have to be careful how I answer.
Of course.
In a perfect world, it would all be decriminalized. We would all have access to these medicines freely. And on the flip side, you would have all kinds of people misusing these medicines, and then you'd have disaster stories coming out of the other side. So in a perfect world, we would have high levels of education, of understanding how these medicines work. We'd have a deep respect for the Indigenous history of these medicines and how they should be held in sacred ceremony. So there's all that side. What do I think? Yeah, it'd be great if these are completely decriminalized, full stop. But with that would need to come a different level of education than we currently are experiencing. Because I know, unfortunately, in the underground, as we're seeing in the media, there's a lot of stories of stuff going wrong, of people being treated very badly, misuse of medicines, overdosing, different things that are happening. So yeah, great to have them decriminalized. And this Health Canada process is painful. It's just really, really slow. But it is forcing people to take these with deep respect. So yeah, that's a convoluted answer, and I won't be held to anything I just said.
No worries. So at your journey centers, then, are most of the people that are being treated in clinical trials, or are they in this Section 56 and then maybe in the future SAP pathway?
Yeah, we have a few still in the Section 56 process, but they're very clearly palliative care patients.
Mm-hmm.
And Health Canada is being more and more tight about even the timeline of their prognosis. That if it's like a terminal disease, but it's years away, likely they will just say no at this point. That's what we're finding. Whereas if it's very imminently palliative, then we're getting more positive response. But it's very, very individual right now. So the trials are where they're pushing us to. And in our push to train therapists, we've applied for a safety trial for psilocybin for what they term healthy normals, which is our therapists. And we're starting that process. We've received the no objection letter. We've received our ethics approval. And we're looking at starting the first cohort of those people to do psilocybin training with psilocybin, with therapists holding space for each other, starting in the month of May.
So how important is that the therapists that are giving the psychedelic therapy have experienced it in their lives before? Is that something that's essential in your opinion, or is that something that would be nice but is not necessarily necessary?
That's a very, again, loaded question. I firmly believe that therapists should understand experientially what this is like. I don't believe it's possible to fully be present for somebody going through a psychedelic experience if you've never been there yourself. And the case can be made, well, we give pills for cancer, we give pills for headaches, we give painkillers, whatever, and we don't necessarily have to use them as doctors. These are not that. These are not pills to reduce pain. These are not pills to reduce cancer cells. It's a spiritual process of going into the trauma and dealing with what is holding us back, what is causing depression, PTSD, addictions, whatever. So looking at that, it's like apples and elephants. It's not even the same fruit. Like you just can't compare a typical pharmaceutical drug with a psychedelic journey. And so experiencing that yourself, to me, it's not even a question. It must be done. For to be an effective therapist, many companies out there disagree with me, and we can have differing opinions. I'm fine, but I'm getting more and more adamant about the fact of how important it is that people take these medicines themselves and understand how to best be there for that person.
Yeah, I think I would agree with you that that's probably essential, that they have like some sort of personal understanding of what the person in the room with them is going through in that moment. So shifting gears for a second, you are part of this really exciting conference that's happening soon. It's called the Catalyst Conference. It's happening in Kingston, Ohio, starting on May 20th, I believe. I think I got that date right. So I was wondering.
We're actually in Ontario, but Ohio's cool too.
I don't know why I said Ohio. I'm literally, I live close to Kingston, Ontario, so I don't know why I said Ohio. But yes, I was wondering if you could talk a moment about the Catalyst Summit.
Yeah, for sure. It's we started this about 5 years ago. We've run it now. This will be our 3rd year. But the concept, we started way back in Calgary to be a live conference, dated for May 20th, 2020. Which we all know what happened just before that. So we ended up going online to do a virtual conference the last 2 years. And since then, everything has changed in this industry. There were no public companies. CPA was just starting up, the Canadian Psychedelic Association, and we joined forces with them, and they were a big part of putting this on with us. And since then, we've seen the public companies coming up and all the activity and all the legalization, the Section 56 thing in Canada. So many trials coming to the fore that it's become a different space completely. And so now coming together, we're like, where do we host this where it's going to have the biggest impact? And being close to Ottawa, we're actually getting Health Canada to be present. We've got a lot of the bigger companies going to be there. And it's just a very exciting prospect to actually be together with the psychedelic industry and the folks that we've gotten to know through Zoom and actually meet face to face and talk about where we're going with this industry. So really, really excited. The Summit website has a list of the speakers, and it just keeps growing with just incredible voices, working with people like Paul Stamets and Pam Crisco and Trevor Miller. And the list just keeps going. Yeah, I think if you scroll down, Tony Bossis, Jane Philpott, our former health minister in Canada. It's just a fantastic lineup of people.
Yeah, I mean, obviously they're all absolutely fantastic, but I'm really excited to see Paul Stamets. I think that he's really one of the thought leaders in this entire space that has been kind of pushing this narrative that, hey, psychedelics are not only safe, but they can be really beneficial for, at a minimum, a certain subsect of people, if not everybody. And he's been out there since before this was popular, since before this was even tolerable, I would say, to be discussing out in the open. So it's just really exciting to get the chance to hear and maybe even talk with one of the thought leaders in the entire psychedelic space.
Yeah, very true. He's pioneered a lot of work, even in other non-magic mushroom strains. Some of the work that he's done is it's fascinating.
Yeah, I mean, and on that note, it's really fascinating, just mushrooms in general. Again, not the magic, or not necessarily just the magic variety, but it seems like the more we learn about fungi, the more beneficial all around they seem to be from all sorts of different health lenses. So yeah, it's just going to be absolutely amazing to listen to him speak and maybe interact with other people there. David, is there anything else that that you wanted to discuss before we end this interview?
Yeah, another really exciting part of Catalyst, but it's kind of a standalone thing, is we're doing a business day on business luncheon on Friday, the 20th, where we're coming together with a number of companies in the industry and forming a bit of a coalition to help create a voice for Health Canada in bouncing off ideas and having them be able to go to rather than reaching out to like 6, 8, 20 different companies trying to figure out what this industry is, working with them to help get this across the line. I do believe that Health Canada wants to see these medicines brought to the people, but they really want to be making sure there's no repeat of any of the stories. I'm not going to say the realities, but the stories of the 70s, that there's no disasters, there's no fatalities, there's no accidents. And so that's their job, to keep us safe as Canadians in the medical industry. So we need to work with them. The reality is they are making the guidelines and the policies. And so that's a big part of, in my mind, kind of the highlight for me in the conference is getting all these people together, these brilliant minds like Pam Crisco, Paul Stamets' partner, and the different companies from Field Trip to Numinous to across the board, that they can actually start to work together. I'd have a real call out for the companies that if we can work together to get this across the line, then yes, we're competitors, whatever that looks like. We all have our programs and our offerings. But if we don't get it across the line, there's nothing to gain and there's no people to help because it's illegal still. So that's a big thing for me, is seeing Catalyst become a catalyst for change in the Canadian landscape, in the regulatory world.
Yeah, I was talking with Patrick Mower recently, who I saw will also be attending, and he used a really cool word. I think it was coopetition, combining cooperation and competition to describe how different companies in this field really need to be acting right now. Because if we don't get these type of legislation passed, and the type, maybe not legislation, but the type of regulatory framework created that we need to see, then nobody's going to benefit from it. So like you said, of course we need to, or well, not we, but companies in the space will eventually be competing on different metrics. But right now we really need to see cooperation, which is why I think this, what did you call it? The business summit, business luncheon?
Yeah, just, I don't know if there's an official title. We're just working today, actually, but a business lunch, and it's right at Queen's University in Kingston as a precursor to the conference.
Oh, that is really exciting. And just going on a little bit of a tangent here for anybody that's watching, I will most likely be there also. So if anybody watches this channel and they'd like to come up and say hi and chat a little bit, that will definitely be a great opportunity to do that. Anything else, David?
No, thank you for what you're doing. You've been a big supporter, and really appreciate the work you're putting out into the world with these interviews and podcasts. It's really good to see.
Thank you so much for that, David. And thank you for leading a psychedelic medicines company. Again, we kind of led with this, but we're in the middle of a mental health care crisis. And anybody that's working to ease that burden on society is doing amazing work. So thank you for all the work that you and ATMA and Catalyst and everybody else in the industry is doing.
Thank you.
Perfect. I'll talk to you soon, David. Bye.
See you.